From a dentist perspective, I can appreciate that we've come a long way. But from a parent perspective, we have come such a long way.
What you're starting to see right now is the restorative doctors are driving the movement. It's starting to be a discussion of like, how does this disease affect our management from the dental side?
We have to give grace to each other that maybe someone just isn't in the place where you're at. And how do you have a discussion with that person respectfully as colleagues to get them more open to where you're coming from?
If we look at the evidence in the medical literature, by the time you hit 7, you're already too late neurocognitively. If I'm touching a 4-year-old, I am not advocating the prevention of orthodontics. And we have to be really honest with ourselves about that.
The goal for this 4-year-old is not to help with mandibular growth. It's to have airway patency for this child right now.
When we have companies that are saying this appliance will cure your apnea, your child is going to be a different child with this appliance, it hurts the community.
Let's just really remember what evidence-based medicine really is. It's not just literature. It's not just the research.
Evidence basis is actually a composite of 3 things, right? It's the research, the data, so to speak. It's clinical experience and expertise, and it's patient values and perceptions. So if you think of it like a Venn diagram, evidence basis is where those 3 things come together. It's the confluence of those 3 areas.
We've talked about forming a PBRN, a practice-based research network. I know that there's a lot of members who are interested in participating and contributing to the literature in that manner.
So tonsils and adenoids, expansion, myofunctional therapy, diet, gut health. Just because one thing isn't the end-all be-all doesn't mean you don't do it at all.
The more we understand the consequences of no treatment is when we're going to want to do treatment. My goal is never to treat sleep apnea. My goal is to assist your medical team in managing this disease from a craniofacial standpoint.
Why don't you become the specialist and open up your mind to what specializing in orthodontics is? It's not just about the bread and butter Invisalign patients. It's about airway, craniofacial development, helping a child's overall wellness. Why don't you become that kind of specialist and really set yourself apart?
I think that we have to find ways for us to come together to manage our patients better.